So let's talk a little bit about women's health. It's definitely a passion of mine. I presented at national meetings talking about radiofrequency tightening and labiaplasty, and I perform a lot of it in my office. So let's talk about the different options that we have for women who are experiencing any kinds of women's health issues. Let's first talk about some stress urinary incontinence. It's one of the most common complications or problems that I hear from patients. So we have several different options for that. So this is our Morpheus device. One of the things that it offers for patients is something called V-tone. That's basically like going to the gym for your pelvic floor. So after having babies, being a little bit older, our pelvic floor muscles get very lax, and that can cause stress urinary incontinence. The V-tone machine helps to stimulate those muscle contractions, gives you like an ultra workout for your pelvic floor, and helps to prevent stress urinary incontinence symptoms. The other thing that we offer through this device that helps with stress urinary incontinence is something called Morpheus V. That's where we go in and do microneedling with radiofrequency inside of the vaginal canal. Now, not only is that a very powerful way to treat stress urinary incontinence, but it also helps with vaginal laxity, vaginal dryness, and improving sexual satisfaction. Now, along with that Morpheus V, we can also do a little bit of tightening around the area, specifically the introitus, which is that kind of opening, or the perineal area that can be a little bit lax after having babies or with age. So those are some great options that we have for this device. Now, this device also has a different option that is more for the external stuff. So that is called the Aviva, and that helps with people who are just like borderline needing a labiaplasty, which is improvement of the labial minora area. It can also help tighten the labia majora area and the surrounding areas. So that's done underneath the skin. It's a surgical procedure that we can perform under local anesthesia, but it really gives you some tight, impactful tightening of that area. So that's some super interesting things that we offer with this machine. Now, for my patients who have a little bit more extra and they need some more surgical tightening, we offer a vaginoplasty, which is where I go in, look at those muscles that have separated, tighten them up, pull some of that vaginal canal out to really tighten up for vaginal laxity there. We can also do a perineoplasty, which is tightening up that introitus area. And then one of the most common procedures that I perform is a labiaplasty. That can be done under local anesthesia in the office. Most of my patients tolerate it very, very well with just local anesthetic and some pain medication afterwards. And then we even have Pronox, which is like that nitrous oxide that you can use at the dentist's office for some of our patients that are a little bit more nervous. Now, the most common reasons why my patients come and get labiaplasty, it's not really for vanity purposes. Most of my patients have extra skin that causes them discomfort or pain, either with exercise, regular activities, or with intercourse. They also have some visibility in their clothing or bathing suits that makes them very uncomfortable. And so those are the most common reasons why people want labiaplasty. It's a really easy procedure, very little downtime, and my patients do very, very well with it. So that's kind of our all-encompassing things that we offer. Another thing that we do also that people ask about a lot is called a PRP shot to the vaginal area. That really helps with sexual satisfaction and with vaginal dryness and a little bit with urinary incontinence as well. And so all of those things, we can come see you in clinic and kind of tailor to your needs, find you a great package that works for you.